The Osun State government and development partners have been urged to intensify efforts towards closing the gap in access to family planning services. This comes as the state has achieved a 6% increase in contraceptive prevalence rate, moving from 29% in 2018 to 35% in 2024. Here is the report.
According to the World Health Organization, use of contraceptive prevents pregnancy-related health risks for women, especially for adolescent girls. It also offers a range of potential non-health benefits that encompass expanded education opportunities and empowerment for women and sustainable population growth and economic development for countries. In line with its support for Osun State on family planning interventions, a reproductive health solutions group, the Challenge Initiative (TCI), held the final end-line review of activities in 2024 with health and media representatives in attendance. Speaking at the event, the Osun State Family Planning Coordinator, Mrs. Ololade Abaton, revealed that the state has achieved 6% increase in contraceptive prevalence rate, moving from 29% in 2018 to 35% in 2024, according to the Nigeria Demographic and Health Survey report. She, however, revealed that despite the successes recorded, there is still a significant gap in access to family planning services.
Means we have an increase of 6%, which is a very good one to us. And that is the effect of the high-impact practices and activities that we have implemented so far. So far, so good. We have recorded at least huge success to that effect, from moving from 29% to 35%. Because we know it is not easy, considering the rumors, the myths and misconceptions associated with family planning. And so coming together with all the thematic areas, the activities already scheduled, and we'll be able to at least implemented all this, and we've been able to reach that success in the year 2024. Our goal is to reduce maternal morbidity and mortality rates. And for us to do this, family planning services must be readily available to our women, which means our women should have access to quality services. And we are going to do this through further training of more service providers, provision of commodities and consumables, demand generation activities, which the media is very critical.
Also speaking, the Adolescent Health Desk Officer at Osun State Primary Health Care Board, Mrs. Roselyn Akinlabi, stated the importance of family planning in reducing unplanned pregnancy. She noted that teenage pregnancy is a major cause of maternal mortality and morbidity and urged increased sensitization of communities on the issue.
Knowing fully well that teenage pregnancy is one of the major causes of maternal mortality and also morbidity rate. As we all know that if a teenage girl gets pregnant, there are a lot of disadvantage in terms of their anatomical structure, how mature their body is to even carry the pregnancy, not to talk of their mental stability. And so we always preach abstinence to all our adolescents to keep themselves until they are ready for pregnancy. But in a situation where you have an issue where an adolescent girl is already sexually active, we also preach that they should take on family planning method. We are not training them to be promiscuous, but what we are saying is the danger of unplanned pregnancy. Because for any adolescent that get pregnant, they will always want to do one or two things which may be harmful for them even to remove that pregnancy.
In his presentation, the TCI representative tasked media practitioners on using evidence-based data to support their reports. He also admonished the media to use their report to increase family planning awareness and male involvement in the state.
Reporting is key. And one of the way in which you can ensure that information is being disseminated across the board is your information platform, either by writing, by visualization through the NTA. Or
some of the recommendations at the review meeting include the need for Osun State to procure family planning commodities and consumables, need to sponsor more family planning programs, and the call to amplify the angle of maternal health to increase the involvement of men.